Is Lincoln in the office?
Good morning, everybody. I am going to call to order the meeting of the Public Health Committee on Wednesday, October 16th, 2024. And our quorum just walked in the door, perfect timing. And so clerk, please call the roll.
Juby. Juby here. Silva. Carver.
Carver's here remotely.
Williams.
Williams here.
Young is not here. Sanchez. No. Strathman.
Strathman here.
You have quorum.
Okay, great. And we do have, Mr. Tarver has requested remote attendance this morning. Is there any objection? Okay, no objection heard. Okay, good morning, Bill. And I would like to ask for approval of the minutes from August 21st and September 18th, 2024. Somebody?
Silva asked for unanimous consent, please.
Okay, we've been asked for unanimous consent for the August 21st and September 18th. Any objections? Okay, so be it. And I don't see any public comment this morning. Okay, moving right along. We have in the packet the financial reports. Any questions about them? How am I doing, Rick? How am I doing?
Good.
All right. So, good morning, Mr. Brett Youngstead. We have a report from you and a presentation from you this morning, correct?
Yes, good morning, everyone. All my reports are on file. If anyone has questions, please, I'm always available. Please reach out to me. I'd love to go over it. I do have a presentation. We just completed our last vaccine clinic of the year, so I'm proud to bring you all the data from this year. We continued with our drive-through. This was actually our 10th year. Every year has grown, every year has gotten better, and every year we've gotten faster at what we're doing. The drive-through style is not for everyone. We understand there are about one per clinic that is not happy with the way we run our styles of clinic, and we get that. But to the hundreds we service that find this so beneficial, it's so worth it. This has been our list of clinics. So over the 10 years, we've done 54, which has been fantastic. This 6 clinics a year really has worked out beautifully. And that's the 3 starting April, May, June, taking July off for the staff. and then August, September, October, because again, this is overtime for them. They work their normal 40 hours. And then these 6 clinics they do on top of that. I do understand people are paid, but giving up free time, especially on a Saturday when we're there for like 9 hours, is very valuable time to people. So I thank them for all that they do. These clinics, we do have to run at least one per year, centrally located or at our facility. We service both of those, which is fantastic. So we always meet the state requirement. We also offer microchipping daily at our facility. Just contact us and we'd set up an appointment and get you in to get microchip your pet if you're still interested. This is our animals impacted, and it's just good to see this grow every year. Cats took a little bit of a bump this year, but the dog number continues to grow. Looking at our numbers, again, 657 rabies vaccines were given out this year. That is a huge number, and it continues to grow every single year in what we're trying to do. Dog numbers continue to grow. And looking at our seniors, which is, again, that population that we've really targeted and are aiming for. This year alone at 217. This is the group that is so thankful while we're out there. We actually had one person that went and bought us donuts and came back, and that was very sweet of her. And we really appreciated it. They're long days again, but it is so wonderful to talk to these people. And actually over 10 years, we've gotten to know a lot of them. And it's just wonderful to see them every year and see their animals. And we've had people that have lost pets and come back with their new ones. It's just great, a community outreach in itself. Our cat number did drop a little bit this year, but looking at the numbers, our senior number of cats went up. Again, that's the area we're really aiming for. We push very hard through our library systems and our senior groups. And thank you to those wonderful groups for getting the word out every single year for us. That's what we're aiming for. These are the people that are on that fixed income that we know can't afford the $50 to walk in the door service fee. So we want to make sure we're getting to those people as much as we can. Overall, again, microchips continue to rise, which is fantastic. We do use the minis. We do not use the large. So people do feel a little bit better about them. And again, that price is preset by the state at $15. Clinic revenue. When our tag fees go up, our revenue will also go up. But remember, our tag fees went up because there was a raise in salaries. So it had to coincide. These clinics do pay for themselves to ensure that they're continual and every single year will continue to happen and will not affect our budget in any way. So that is how the fees are set. That's how they're determined. This isn't a profit-making business, but again, I want to ensure that everything is reported yearly to you guys so you do see the profit coming in. But remember, most of that is made up through the salaries. We bring in an extra veterinarian, and we also provide water to everybody that comes to the clinic to ensure that no one overheats or gets sick or anything. Does anyone have any questions?
I have a question.
Of course.
I'm just curious, when the people, when you have one person who is the outlier and complains, what do they usually complain about? That they had to wait too long or?
Our clinics have, especially this last clinic alone, we served 147 people.
Wow.
Clinic started at 10 o'clock. They started lining up at 8:30.
Oh.
Our vets actually arrived early, so we started at 9:15. And the line still was just over 2 hours. It was backed out on the Randall or onto Kesslinger. 2 hours usually is the max, but people, yes, I get it. And we're honest with people. We have people at the front of the line. We have people at the back of the line. So we let them know that from about here, it's about 2 hours. You know, we're like that Great America sign. From this point, it's going to take, because we have it timed.
You don't have to be this tall. to
No,
get that.
exactly. But every clinic, we do time it so we know how we're also pacing, because as a staff, we like to know how we're operating as well. So we've gotten better every year. Our timings do get quicker, but again, when you have people, you know, it fills not only our parking lot, they're circling around the water treatment facility, all the road winding all the way out. And those that know my facility, that is a long road. So that's probably at least about 50 to 60 cars sitting right there. Most of them have 2 pets. So that's the other thing, takes time when you're bringing one animal in, the next animal out. But again, we've really done a great job. That's why the style works so well. We have had no lost animals, and the ones that are lost, because all the other animals are in vehicles, it's easy to contain. We have staff spread out to contain immediately with leashes, so no one's gotten away. The old style, we did have animals get away because everybody thinks their pet is the nicest, or their pet's the most friendly, and you don't know the other animal, but my animal knows your animal. So
Yeah.
somehow, and we had a lot of fights. We had animals break off leashes, and this way is, we've had no incidents. And that's why this way has really worked out. But I do understand it's not for everybody.
Yeah.
And that's what they usually tell us is it's not worth it. I'd rather pay the extra money. And I get it. But to these people that can't afford the extra money, that's what this style is for.
And the convenience of it too, just sounds.
Yes.
To wait is a minor
It is time out of
price
your
to
day,
pay. Yeah.
2 hours, but yeah, we're trying to service as many as we can.
Yeah, sounds great. Sounds great. Does anybody else have any questions or comments? Good morning, Mr. Jared Sanchez.
Can you go back to that first slide real quick? The picture.
That one?
Is it really a good idea for the dog to drive the car?
It's, okay.
You check for licenses when they come in like that?
I've reached a point in my life when I get to say I'm about to age myself. Toonsis the driving cat on Saturday Night Live. I think of that when I see this.
Mike,
Saw it,
did the
so-
dog have a seatbelt on? Is that?
No,
Oh, more violations there, so. Okay, and we do have a resolution this morning authorizing the senior tax fee correction. So I'd like a motion in this a second to discuss.
Sanchez moves.
Sanchez
Carver
moves.
seconds.
Carver seconds, thank you. Right, would you like to tell us about this?
sorry, this is just bringing us into compliance with state law. As we're reviewing our ordinance has not been updated in 10+ years. So we're working on that to get that corrected now. And one of the things that came across is the state does mandate that there must be a $10 differential between not neutered and neutered. So we realized with the senior tag fee being at $0, that meant that any non-neutered senior tags being sold are being sold illegally per state law. So this resolution is just setting that fee to ensure that free tag remains. Any non-neutered, and we're talking minimal numbers, real quick. We're only averaging about 5,000 senior tags a year. Of those, 3,500 are about 1 year, 1,500 at 3 years. We're not talking a large number. And of the neutered, I don't have the full ratio broken down because we never had to do that before. We just had to know senior 1 year, 3 year. We never had to have that full breakdown of neutered versus non-neutered. We're not expecting, this isn't anything to fund our facility. This is very minimal, maybe $2,000 to $3,000. This is not something that's going to be groundbreaking. We're getting a new hire sort of moment. This is nothing more than to bring us into compliance with state ordinance so that we're not in violation.
Okay. Any questions or comments? Okay, please call the roll.
Juby,
Three I.
Silva,
Silva, yes.
Tarver,
Carver, yes.
Williams,
Yes.
Sanchez,
Sanchez, yes.
Strathman.
Yes, passes.
Thank you.
Okay, thank you.
Thank you, sir.
And now we move right along to Mr. Michael Isaacson.
Good morning, everyone. It is hard to believe, but it's the middle of October already. So of course, that means if you have not gotten your flu shot, now is a good time to get it over the next couple of weeks as we enter flu season. Also, it's important for people to go out and get the current COVID vaccine to make sure that they're protected before we start gathering for the holidays that are coming up. We do have a lot of our positions that are being filled, so that's really exciting. Some of these are new grants that we've received that we're starting to staff up, including some work around how we can better serve our long-term care facilities. So again, as we enter the respiratory illness season, Director Onwuda's team is going to be going out with a new grant we have and providing direct service to a lot of those facilities to protect those most vulnerable people who are living in our community. Also, just want to make you aware that we are just about to start union negotiations. So our current contract with AFSCME is coming to an end at the end of this fiscal year. So we're just awaiting their initial proposal right now, and then we're working with both internal and external counsel to go through that process. So we're excited about that. And then finally, just want to raise your attention to the fact that we are working with the ARPA office and looking at some of the money that we used for COVID, and that there may be some funds that were allocated to the health department that we didn't end up needing to use. So we'll probably be running through the ARPA committee to make sure that any funds that were allocated for mass vaccinations, if they weren't used, that they are returned into the ARPA pool so that they can be utilized for other purposes. And then if I could get the presentation, please, Blair. Just wanted to share a couple of events that we have coming up here. So last week, I'll start with something that already happened. Last week was Walk to School Day. So for folks who maybe haven't been around as long, Kane County Health Department launched the Making Kane County Fit for Kids initiative about 16 years ago. And I believe this is our 12th or 13th time promoting Walk to School Day. Over the years, we eventually launched Fit for Kids as its own not-for-profit organization. So it's still something that the county is very supportive of. I serve on the board, and my colleague Jackie Forbes from the Division of Transportation serves as the current chair of the board for Fit for Kids. But every year we encourage our schools to get out. It's typically the first Wednesday in the month of October. Sometimes it's the second Wednesday just to keep us on our toes. But typically Kane County has the highest participation of any county in the state of Illinois for Walk to School Day. So this is just a good day to raise awareness, to get people out there to see the value of riding bikes, walking to school. And it's not only the physical activity, but also for mental health. There's a lot of research that shows how positive that is for people. So we have staff at the health department who works on this and does a great job. So Nathan, Tina, Lily, they do a great job promoting this. So we don't have all of our new numbers for last week yet, but I did include just a couple pictures that some of the schools had posted online. So on the left, we have some of the schools from Geneva who are participating. You can see that we had the Elburn Fire Department kind of in the upper right corner of the left image. Typically, we get great participation from mayors and police departments and fire departments. And again, this is just a great day for raising awareness. Over on the right-hand side is some different images from School District U46. So typically, we'll have between 75 and 95 schools participating, and it's open to all elementary and middle schools, both public and private. And Fit for Kids provides a small stipend to all the schools who are participating to help their parent-teacher organizations. So really a positive event. Also, we have a couple of things going on that are supporting the mental health in our community. So one thing that we hear loud and clear is that families need more support. So as part of our grant from the Illinois Children's Healthcare Foundation and the work that our AOK All Our Kids Network does, we have been hosting parent cafes for many years here in Kane County. So we do have one coming up tomorrow, as you can see on Zoom. So this is a place where, and parent cafes is a great evidence-based model where it's, one of these concepts where the wisdom is in the room, where people can get together. They can share with people who have similar experiences potentially to them and really get that support if they may feel isolated. So yes, ma'am.
Good morning, Director. Good morning, Chair. So I had asked the question previously. I understood from a couple of the liaisons that we have reduced parent cafes. They were adamant. So did we go down in number?
We are looking at different funding streams right now and coming to the end of the grant year for the system of care. So we backed off just a little bit in the last month or so, but that will all ramp back up. And again, we have written for a family-run organization grant, should find out within the next week if we received it. And we've made it to the end process, so I'm pretty confident. And that will, again, allow for them to not only continue their work, but do more work out in the community. And then the end goal is for them to stand up as their own family-run organization. So that's the next funding stream that will come in and support that work.
And we're looking at how many parent cafes per how long? In what time frame?
That I would have to get back to you on. Maria Leone, our children's mental health grant manager, is planning with Liliana and all the parents. You know, it's, again, we have to wait till we know we got that grant, and either way we'll find funding to stand it up. But if we get that grant, it'll be a game changer and the plan will change. So we'll keep you updated as we go forward. And the parents are being kept in the loop on that as well.
So we don't know yet.
We don't know an exact number,
Okay.
but they will sustain at the level that they are.
Right.
And they'll
that-
have more funding to do more hours out in the community between AOK and System of Care and FRO.
We're
Oh,
definitely
okay.
committed to continuing with the parent cafes and the parent support. So regardless of this grant is an excellent opportunity. And as Director Peterson said, I think the team put a great job putting it together. We've had the final review, but even if that grant doesn't come through, we're still committed to continuing this work.
And part of the reason I applaud that, part of the reason that I'm also so curious, because I think this is so helpful. It sounds to me, I'm being told that this is such a great program. We want to see more of it because it really does help us in the community. Okay, when you say that we're sustaining it at the level that it is now, what level is it at now?
Right now, again, I would have to check on the exact numbers. We track all of that, so I can get back to you on that by the end of the day. But again, there's also word from the governor's office where Medicaid is allowing peer supports to be billed through Medicaid. So that's another sustainable way that we would sustain these cafes in the future, even beyond the grants. So there's many different ways that we can hold this work up, and we really value the parents and think that their work is of the utmost importance, especially in the Spanish speaking community.
Well, and I mean, I think we all know, right? It's the children that are most impressionable, and it's the children that need that stability in order for their roots to grow. So of our entire King County community, I think that's so important. I hear you saying that you're committed and that you're looking at it from all possible angles. So I appreciate that. Thank you.
Thank you.
I think it's such a good sign that the parents are, saying, please, please continue. Because it is just such a wonderful program. It really is, and does such a fine job. So thanks for working to continue it.
Yeah, we'll definitely continue, no doubt about that. And this is something we've been doing the parent cafes for over a decade now. And it's one of the best ways, I think, to really engage community, not only for people to learn what's going on, but again, no matter what's happening with a family, for them to be able to get that support and be able to connect, because a lot of people are very isolated out there. Over on the right, another thing that unfortunately is much too prevalent right now is teen anxiety, specifically school anxiety. So as part of our Illinois Children's Healthcare Foundation System of Care program, we have a monthly training series. So this is just one example. These are going on all the time. So this one is coming up next week. And this is in partnership with Geneva School District, but this is going to be online. So there's a lot of opportunity for people to really hear. And this is impacting all of our school districts where especially after COVID, a lot more young people are dealing with anxiety.
And so before you
yeah.
leave that slide, I see that it's for parents and caregivers. Is there any kind of a program like this that reaches the teens themselves?
Absolutely. Yeah. So we work closely with the schools and social workers and the school psychologists to make sure there's connections. Depending on the school district, there may be providers who are embedded within the school providing different programs. Otherwise, as part of our new case management, if anyone calls the health department, they can get linked up with somebody. So
Great.
that's part of the work, is making sure people get to the care that they need. And then in a lot of cases, and one model looks at this as kind of a pyramid. So at the top of the pyramid is a few people who need the most acute critical help. Maybe somebody needs to be hospitalized for a mental health crisis, et cetera. And as you work your way down the period, the number of people who are impacted increases, but the level of care that they may need isn't as acute, isn't as severe. So in many cases with teen anxiety, there's different tools that can be provided not only to the young person, but also to the family, so we can be more supportive, build up resilience, and also help people with different coping skills.
And
So
so more preventative then.
exactly.
Yes, great.
We're trying to put a big focus on as much prevention as we can. And obviously there's a lot that goes into, that's why I think the parent cafes are so important. There's a lot that goes into what's stressing our families out,
Right.
certainly. Also coming up next week, we have our annual Communicable Disease Conference. So Director Onwuda's team has put together a great program. So we're going to be looking at bringing together different people who work on infection control around the community, hospital, schools, et cetera. You can see a couple of the topics there. I don't know, Director Onwuda, anything else? It's always great. We always get fantastic feedback when we do our after reviews of this program.
Good morning, everyone. Yeah, we're looking forward to this Communicable Disease Conference. We usually bring in experts from IDPH and local experts, and our CD team always are presenting like real good data and information that long-term care facilities and hospitals can take back for infection prevention control. So this year we're focusing on vaccine preventable diseases and transmission of syphilis to newborns. It's the number of cases are increasing in that age group, tuberculosis and Mpox. So it's going to be a good day. So we're looking forward to that.
Thank you. And then also over on the right, you can see a partnership that we're doing with Rush Copley Hospital and the Kendall County Health Department around lung cancer screening. So again, lung cancer is one of the cancers that we do lose a lot of people to in our community, unfortunately. So it's important for people to identify as early as possible so that they can get into treatment. And then also we have something coming up, and there's been a lot of discussion around lead service lines and things like that. So we're partnering with several organizations. This is part of the Northeastern Illinois Regional Groundwater Protection Planning Committee, but the health department is one of the partners putting this together up in Elgin. This will be coming up also next week. So there's a lot of great things going on in the health department right now. And we just have so many great employees who are out doing things every day. And then, as I mentioned at the beginning, I'm really thrilled with some of the new hires that we have, that we've brought on some people who I think are going to be really strong for our department. So very exciting. I think that's it. And if there's any questions, otherwise I tried to keep it quick.
Dr. Silva, I do have a response. We do
Thank you.
5 parent cafes per month. 2 in Aurora Spanish, 2 in Elgin Spanish, and 1 virtual in English.
That sounds like an adequate amount. So 5
5
total,
total per month.
but I think we might have been doing a little more before. Is that?
I think it was, again, it's all based on the schedules of the parents and the times and things. So this has been pretty consistent for a while. But there may be months where there's special events or different things
A
like
little
that
more.
where they were elevated.
Okay, thank you so much. That
Thank you.
sounds like a really good amount.
Okay, and we do have a resolution this morning, which is authorizing opioid response community implementation projects. If I could have a motion in a second.
Tarver makes a motion.
Okay, Sanchez moves, Tarver seconds. Thank you. Up to you.
So as part of our comprehensive efforts to reduce overdoses in the community, this is using some federal funding that we get passed through to us through the Illinois Department of Human Services. We did put out a competitive request for proposals. And then the organizations that are listed here are who the team identified to carry out these activities. So you can see it includes the Ecker Center for Mental Health, the START program, Association for Individual Development, Greater Family Health, excuse me, the Kane County Sheriff's Office, and the Kane County State's Attorney's Office. You'll also see, just if you really like getting into the details, there's also therefore let it be resolved that we two of those to our internal county partners will be line item transfers rather than grants that go out. So happy to answer any questions.
Any questions or comments? Okay, please call the roll.
Doobie,
Aye.
Silva,
Silva, yes. Silva, yes.
Tarver,
Carver's a yes.
Williams,
Yes.
Sanchez,
Sanchez, yes.
Strathman.
Yes. Okay, it passes. Okay. Is there any old business? Yes, Dr. Silva.
Thank you, Madam Chair. I did want to remind our colleagues that we received a letter from Lovey Fields with the King County Collaborative Division. And they are involved in a lot of good mental health programs with the sheriff's office, which includes diversion and prevention. And they're asking us just to sign on to what they do. And the reason that this is so important is to show our support, because then they take our signatures to the state when they're asking for grants or applying for grants. So I would like to remind everybody to please, it's back in October 2nd. If you haven't yet signed it and returned it, please, and return it, please do. Thank you.
Thank you for that.
And Madam Chair, I would just say that the Collaborative Diversion Program is a fantastic initiative to really reduce the number of people that we're incarcerating by dealing with root cause issues. So there's a lot of people who may be in jail because of a substance use issue or a mental health issue, and programs like this that are run through the state's attorney's office and the sheriff's office. And we work very closely with them. It's an amazing way. And not only does it improve people's lives and get people back on their feet, but it also is a way that ultimately saves taxpayers money in King County. So win-win.
Great point.
Yeah,
Thank you.
win-win all the way around. Okay, thank you for that reminder. Okay, and I'd like to have a motion to put the reports on file.
Williams will move for or request unanimous consent to put the reports on file.
Okay, thank you. Any objections? Okay, I don't have any new business. Does anybody have any new business? Okay, then I'd like to have a motion and a second for adjournment.
Sanchez moves.
Des moves.
Carver seconds.
Carver